And now I would like to change gears and introduce our next speaker. And like I was talking about how everything seems to overlap. Janet and I met in a business group, actually, but my health knowledge is really from having been kind of through it myself. And Janet has so much practical experience from her work as an RN. And based on what she saw that Western medicine can do, and maybe not as much, Janet also has added in some additional ways of helping folks. And as we were talking about what my experience of having been through cancer was like, and the other people that I talk to and help, it turns out that that's one of the themes of uh, why um, why Janet Olsen is able to be so helpful for her clients. And so I kind of almost twisted her arm a little bit, maybe, to come on and help us to see from the perspective of a medical practitioner how to make all this scary, complicated stuff that, just might feel too hard to do when you're not an expert, to help us know how to approach that kind of situation. So welcome, Janet Olsen.
Well, thank you. Thank you for having invited me, Julie-ann. And thank you for those watching live or those that will catch the replay. And as Julie-ann had mentioned, yes, I've been a nurse for 46 years now, mainly doing some sort of community nursing. And I think that got me to see people in the real world, right? You have people when you're in the hospital, it's one thing, but when you're in the community and you're living in real life and the day to day, it can be different. And granted, many of the people that I work with have been what would be considered underserved and with minimal resources. That's where I saw that the lack of simple health, simple daily practices, simple lifestyles contributed to their continued illness. The complication, I think our Western health care system is great. I mean, for many things. However, it also can disempower us, can it? And why is it that we are so, our rates of chronic illness is going up, even in children, right? So it's not meeting some of our needs. And certainly that's a whole nother topic to go into things going on in corporations and what we buy and everything like that. But I loved what Andrea's presentation and her connection to self-love. And that's what I want to bring in with my presentation here too, is everything you're going to do is for self-love, right? So you can heal, you can get back to your community the best you can. And Andrea's nutrition from 5,000 years, at the end, I'm going to present a energy movement with Qigong that is over 2,000 years old. So we are doing some ancient health here, aren't we? So anyway, to move forward here, what can make the healthcare system winnable for you? And what I have found is, what are your goals? What is it that you are focusing on right now? And what is it that you can make winnable for you? And I am aware that for some people, you may be, if you're currently in an illness, or perhaps you're in recovery, but maybe you're working with a large medical system where everything is in one place. And in some respects, then you don't have to travel far for your appointments. Everything is coordinated more so. But for other people, a smaller community, perhaps, they have to do more traveling. Maybe they have to do more coordination on their own. And I understand that can be more difficult. What I am encouraging you to do is to make life as simple as you can for yourself. Use the processes that are available for you within the clinics, within the system that you're working with. Don't be afraid to ask questions. Don't be afraid to have them assist with appointments that perhaps are difficult to manage, certain times of day, certain days of the week or whatever. Make that known to them. Have a cooperation there where it's winnable for you.
So are you saying ask questions or stand
Yeah.
up for yourself?
Correct, Julie-ann. Know, like for instance, what days, like perhaps you're going through treatments or treatments, and you have certain days that you're not going to feel good or feel good after, right? How can you proactively work around that? And so what days might work better for you then, so that oh, I got the weekend off now where I can rest. Or if I have my treatments on a certain day, that I know that I have family or friends that are available then that day, or maybe a couple days after, that they can assist me if I need help. I encourage you, as I'm talking through here, ask for help. There's no greater gift than to accept a gift from a friend or family member. Don't ever feel that you, I'm going to be a bother. I'm just a nuisance or whatever. Don't ever feel that way. Going back to what Andrea said, this is about self-love. Now is the time to take in all the help that you can, be it from the clinics, friends, neighbors, co-workers, whatever. If they don't want to help, they're not going to ask. They're not going to offer, I should say. So take advantage of that. And I know it can feel vulnerable, but boy, that can really build a bonding too, can it? So again, going back to your clinics and empowering yourself and saying, well, what would work better for me for timing, and how you can get help afterwards. I know sometimes that might be a little bit difficult, but I think it's worth a try. It's worth advocating for yourself. Don't be afraid to ask questions. Again, you're not a nuisance. Okay. Oh gosh, I should understand this. What's going on with me? No, you're in high anxiety when you're ill. So, you don't process things as well. Medications can make you brain fog. And just again, the anxiety. Ask questions. When you go on appointments, take a notebook with you. And what I advocate is writing down the questions that you have beforehand so you don't have to think about it when you're at the appointment. And also jot down little things between appointments about how you've been feeling. Maybe it's minimal, maybe it's something significant and you're kind of blowing off. Maybe how you're feeling with a medication or after certain treatments or whatever. But these are all things you can write down ahead of time. That way, when you get there, the appointment can run smoother. You got everything there. You don't have to think about, what I might be forgetting. And then, jot down the findings from the appointment. Also, you might want to consider recording the appointment. And that way you can listen to it after. Or take a family, a friend along. It's an extra set of ears to hear what is being said.
So true. People who came with me to appointments
Right?
always seemed to pick up on something different from what I did.
You bet.
And often it was very helpful.
A matter of interpretation sometimes also, right? And use a clinic or nurse liaison that might be associated with your doctor's office or the center. And again, I'm advocating calling them when you need to. You have questions, you think something's not right, call them and let them know what's going on. I know there are people in the past that they didn't want to pester. They thought, this isn't important. You call, you leave a message, they get back with you. Maybe it's at the end of the day or within 24 hours, but if it is something important, they'll get back with you sooner. Don't blow things off. Again, when you're in a high anxiety, you think as well, but you also need more help to calm. So it's okay. Use those resources. Don't be afraid. Also, one thing that I had noticed regarding appointments is finding a folder, finding a binder that you can keep all your appointments or your papers in, your appointment summaries, or having another one with educational materials, whatever, maybe one for bills or whatever. But keeping your papers all in one spot and you know where to reference that, especially, and that someone, a family member also knows where that is, so that they can reference if need be for follow-up appointments or when to call the doctor, that kind of thing. And the other tip I have is using support groups. Depending on the illness, I find these support groups to be very, very beneficial. And some of them are now in person. They still have online, but it's talking with people who now with Julie-ann, business and cancer, but talking with people going through the same condition where it's just they understand what you're going through, right? And they can give you practical tips. Hey, this works for me. You might want to try that. Um, and it also can be a source of comfort for family members also to be doing that.
Yeah. You're right. There are tremendous resources available online now for people who aren't able to, get to the support group in person, for example.
Yes, yes, yes.
In fact,
So
that's one of the things we're doing with this is taking part of the VIP proceeds
yes,
and donating it to cancer support community. So if you're looking for a community, there's an accessible link to them right on the summit pages.
excellent.
And if it's not you or it's not cancer or whatever it is, there's still a wonderful place to help direct a person to something that's going to be helpful for them.
Yeah, yeah, very good. Um, do you have any more other questions regarding that, Julie-ann?
Well, yeah, I guess I wanted to talk a little bit about, and this might be almost connected to what your role is. But one of the people or job titles that I often send people to look for is a nurse navigator or a social worker who's attached to the particular department that you're dealing with, because they can be very helpful in sometimes we don't know how to advocate for ourselves.
Right.
We may take Janet's advice of, if you can get a ride on Thursdays, you might be willing to say, hey, I can get a ride on Thursdays. But having one central person who can help you understand how to coordinate different
Correct.
visits with the days you have rides or those kinds of things, there's a role like that.
Yes, yes, the nurse navigator or some liaison person. That's right.
Mhm.
So, and I think they are more common now in the medical centers. Um, so search that out, definitely, definitely, to help coordinate everything and make it as smooth a ride as possible. Even perhaps if transportation is an issue, right? That they can work with that with you.
Yeah. And if you have a home health nurse, yeah, is that a person to ask about how to go about connecting?
The health, I think that there will be with a home health nurse. Um, Certainly, they come in with specific orders, whatever um, the discharge instructions are, but they can also be a good resource for you. And a lot of times with home care, they also have a social worker or other contact people that can give you information. So yes, I I agree with that. Yeah, very good. Now,
I know go ahead.
go ahead, Ofer.
Well, one of the things that we talked about ahead of time was just the notion that you might have your binder of information, um, but then at home it can still just feel like a lot. So I know that you sometimes help people um, navigate sort of making adjustments to how they go about daily life to allow for their healthcare needs?
Yes, yes, yes. And I'll go into that now a little bit.
Okay.
Um, so one thing, how can you make your medication regimen more simple? And one thing that I advocate is using something like this, a little Mediset. Now, I use it. It's easy. I just put my supplements in there. Um, Now, but depending on your condition, you might need several of these, right? For the times of day. Um, another, uh, so they might come with multiple cases of this, or you can purchase something from the hardware store or the craft store that is, just that you might use for beads or artwork or whatever. But then you can label those because I know you might have medications that's before breakfast, and then you take after breakfast, and then maybe again at noon, and before supper, and at bedtime. So, it can get complicated. It can get complicated. So, to have some sort of a system where you can take and fill up for the week, and then all you have to do is open and go, oh, yeah, I took it. So that works. Now, if you use a bottle, and you may have several of those, you can always take the lid, write on the lid, AM or PM. However, if it ends up being several times a day, it might, I find this a little more complicated. Sometimes that's why I like the Medisets. And then what I would recommend using with the bottle is then maybe having a calendar where then you can divide that into the times and go, okay, check, I took my morning, check, I took my afternoon, check, I took my bedtime. So then you know that, you have taken your medications. No, uh, the other thing is I recommend that you use one pharmacy. I think that's good for everyone, but especially if you're uh, any complications. And the reason is that if you're if you're using a couple different pharmacies, they may not know everything that you're taking, and flags won't pop up if there's drug interactions. So I think it's good to use one pharmacy, and perhaps nowadays with insurance, that may be a more easier route to go than uh, maybe in the past. But the pharmacy, like I said, the medications, there can be flagged if there's interactions. But build a relationship with your pharmacist where you can talk with them and say, hey, could this be a side effect? Or I'm noticing when I take this med, I'm feeling this way. And they can look, and they are more knowledgeable to say, well, why don't you tweak it a little bit, take it a different time of day, or we'll consult with your doctor regarding um, if the timing can be adjusted, or maybe don't take with this particular med. Maybe we need to arrange things a little more. But I think it is good to build a relationship with your pharmacist.
I'd never thought about that as far as side effects, but that makes a lot of sense.
Oh my gosh,
Um,
every med has side effects, right? And when you have you for instance, what's the most common? Let's say constipation. So you have one med that side effect might be constipation. Oh, I'm fine, not having any problems. Now you're on a second med where you can have constipation, a third med, well, then at some point it's like, oh, okay. So is do the meds, is there something then that can be pulled back or something exchanged? Or might you need to take something temporarily for the side effects, or adjusting your diet or that type of thing uh,
Mhm.
to counteract that? Yeah.
That is so true because a pharmacist is going to know if you have sort of a pileup of side
Right.
effects,
Right.
even if it's not a situation of like you were talking about flagging. But I think it might help people to just walk through a scenario, if we could, of let's say you have whatever it is that you already have at your pharmacy, and then a new medication is ordered for you. Um, and and we're just going to tell a story where it could get flagged. And I don't know if you have any particular patients in mind. Of course, you wouldn't say personal details,
Right.
but could you
Right.
walk us through a story of what does that even mean, and how do you walk through that?
Mhm. Um, well, with you go to the doctor's office and they go, okay, they're going to send electronically um, a, a certain order to the pharmacy. And uh, well, one thing is that the pharmacist, they will know if your insurance covers it or not. So I have, that is probably the most common, is that um, oh, I'm sorry, your insurance doesn't cover this med, or this is how much your copay is going to be. And then what can be uh, perhaps substituted? The pharmacist can work with the doctor. What could be substituted that's in the formulary for your insurance, or that would have a lesser copay, that is generic and is perhaps even not a copay. But there might be some medications that should not, and off the top of my head, I can't think of an incident, but where a couple meds shouldn't be given together, perhaps, or it might accentuate the side effect even more, and that is highlighted then in the pharmacist's profile, and where then they can contact the doctor's office and say, hey, are you aware of this? And I know sorry, I can't think of anything in particular, but I know that can happen, and then all that can get kind of worked out before you have to pick up that med and pay for it and find out that it's not something that you should be taking.
Mhm. Yeah. Yeah, and or even also just find out, like, maybe what side effects to look out for, that kind of
You
thing
bet.
too.
Take the time to read the medication sheet.
Mhm.
Take the time to
Yeah.
read it. And, it may have major side effects, minor side effects, but at least you have it in the back of your mind going, oh, I never had this um, stomach upset before. And oh, yeah, that med has that. And now, oh, I'm on another med that might give GI upset, right? Yeah.
Yeah.
So reading
Yeah.
those profiles and keeping those again in your folder or binder or whatever, so you always have that for easy reference if need be.
Mhm.
But again, to
Yeah.
call, build a relationship with your pharmacist. Mhm.
Right. I just wanted to throw in an example from my life in case it's helpful to anyone. And this was for a relative who at one point was taking blood pressure medication to lower blood pressure. And after a while, with some lifestyle changes, he didn't need as much. And but it was still kind of within sort of the range of reasonable. And then sometime after that, a new medication came along that had a minor side effect of reducing blood pressure. But on top of the fact that his pressure was already kind of in the low end of where you wanted it was very helpful for the pharmacist to say, oh, you know, you should be watching your blood pressure.
Yes.
And when it did go low enough that it was actually like, we should start paying attention to this, the fact that the pharmacist spoke up about it, um, I don't think that he would have taken it very seriously on his own. Um, but having that question asked
Hmm.
because of having that relationship with the pharmacist
Correct.
was super helpful. And then that was able to kind of go back into um, their whole process at home too of um, as well as go back to the medical professionals to say, what do we need to do about reconsidering what the right dose is or
You
whatever
bet.
it might be.
You bet. You bet. And y- yes, like with the blood pressure, yes, maybe you're doing lifestyle changes, and you're losing weight, and or you're decreasing your salt and everything. So now you don't need as much. So, um, but the so th- those are things that can happen, and the pharmacist can then go, oh, okay, perhaps you're on too much. Yeah. Um, the next thing was talking about nutrition made simple.
Yeah.
And I think we had a wonderful presentation from Andrea regarding Ayurveda. And what I was what I'm going to just highlight, I think, with what Andrea had talked about was, eating the whole foods, the nutritious foods, right? Um, I had I had put down asking for a dietary consult if from the
Mhm.
hospital or at the clinic. However, with a little caveat there, is that a lot of times it's a one size fits all kind of approach. And this is what you should do for this situation. And again, we all are unique, aren't we? So knowing what foods work for us, and it might be a little experimentation. What I also recommend is seeing if in your with your insurance, with your clinic, or going on the side. Ayurveda is one approach, or consulting with a functional nutritionist. A functional nutritionist works with um, uh, not a one size fits all approach. So they will look at your whole profile, what you're going through, your labs, everything like that. And they then recommend certain nutrition and supplements for you. So I think that we are hearing more about functional nutritionists now, and you will find more of them in your community or perhaps even at your clinic. But as Andrea had said, um, shopping for your whole foods, um, and maybe you have been somebody that, my diet's been pretty crappy. So, what little steps can you do to make it winnable? To make a whole, 180 turnaround can be daunting, perhaps. So, what little things can you do to start making it winnable, right? So,
Mhm.
looking at planning ahead would be one thing. So, uh, what days do you have the energy and the time that you can do the shopping and being mindful about the foods that you buy? Or can somebody go shopping for you? Would be one thing. Um, Planning your meals ahead of time and maybe maybe you're going to cook kind of for the whole week, where you can cook up a couple days worth and freeze for that, or maybe you're going to cook a couple times a week, whatever works for for your lifestyle. But planning ahead, having those basic foods in the house and planning ahead and asking for help if need be to help with the cooking and the meal prep. And I loved what Andrea had said about being mindful about everything that you do, mindful about the shopping, mindful and loving towards yourself about why you're making these changes in your lifestyle, mindful and loving in the preparation and sitting down and eating together, having a meal together, a nice conversation versus how many times do we eat and run, right? Eat,
Yeah.
eat and run, eat in the car. Um, we're uh, doing other things. And to make it a meaningful meal where there's good digestion, and then, as Andrea said, a little movement afterwards. And certainly a big thing, I think, making this number one with nutrition is looking at the sugar content. That's for all of us. Sugar
Mhm.
feeds the cancer cells. So start looking at the amount of sugar that you're eating. Just even starting there. What are you drinking? What are the processed foods you might be buying? And if you can start decreasing that, again, just make actions doable for yourself.
Mhm.
And then, again, reading the labels. Um, and you may be somebody who hasn't done that before. And you start reading the labels and what are those first two or three uh, ingredients in the labels, right?
Mhm.
So it's just starting to plan ahead again and um, being mindful of the foods that you're buying. And now the farmers markets will start opening soon, and
Mhm.
you're able to be having the more fresh foods, getting involved with local farmers or your meats or your dairy, so that would be fresher also, if that's possible.
Yeah. So going back to labels, um, that can feel pretty daunting. Sometimes there's a whole lot crammed in very small type, and, um, and it's helpful to know like one or two little things to focus on. Um, and it sounds to me like what you're suggesting is that the carb count is maybe a bit less important than the ingredient itself to see if it's, is it rice or is it some kind of processed sugar additive?
Correct, correct. If
Okay.
you're buying something and there's so many ingredients that you can't even pronounce, those
Mm,
are the things that you should start getting away from. And
mhm,
so, like, um, uh, Andrea had mentioned basmati rice, correct? Versus are you buying some sort of a packaged rice dinner? Okay,
right.
right. And there you have the convenience. However, If you look at that box, you're going to see all sorts of ingredients. And again, chemicals that you don't even, what are these? So if you don't know what they are, we don't really need those in our body, do we?
Yeah.
But again, it's just a step, Julie-ann. I'm not telling somebody because that can be so daunting, but oh, I never did look at the labels before. Oh, maybe I will
Mhm,
start doing that. You know,
mhm. Yeah. Yeah. One of the things that uh, someone kind of brought into my life at one point was to uh, just try to get more, make sure that I'm having a daily apple or vegetable or whatever that's in its natural state of how it came off the tree or out of the ground.
right, right,
And you know, look forward to that good thing more than putting a lot of my effort on, oh, I've got to give up whatever my favorite thing
correct,
is, my
correct.
chocolate chip cookies.
Yes, not exactly. Looking at your life as not, oh, do I have to do this? No, I get to do this. I get to do this for myself. Right?
Mhm.
I realize the time here. I'm just going
Yeah.
to I'm going to highlight just a little bit into self-care before I go into the energy movement.
Okay.
And I just want to recommend to people, do you do self-care? Or is that something that, well, I'll do it if I have the time. Oh no, I'm not that kind of person. I have too many other things to do.
What is self-care really? Is it going for a
Well,
pedicure?
self-care is so individualized. If a pedicure brings you joy, puts a smile on your face, that would be your self-care. But if you're a person that, no, I don't care for that, but my friends keep saying I should go do that. My friends keep saying I should go to have a massage or I should go to the spa. If that's not going to make you feel joyful or put a smile on your face, pick something that does. Maybe it's as simple as telling your family, hey, can you give me 20 minutes uh, when I get home, or 20 minutes in the evening where I can just sit and read a book, where I can just soak in the tub, where I can go for a walk by myself. That's self-care. That's self-care also. As simple as that. Yeah. Um, and the one thing I want to highlight about that is emotions that come up. Emotions are not our enemy, okay? Emotions are telling us that something's going on in our body, that something we're reacting to. So don't shame yourself for having certain emotions. Just acknowledge that I'm feeling this way. And what can I do about it? Why am I neglecting myself? What plan can I make to make self care now a priority for myself and seek some sort of support from a friend or family member so that it becomes a highlighted event on your calendar instead of something that maybe I'll get to, um,
Mhm.
but something that you can look forward to and giving you some joy. So I did want to get to my energy movement. Do I have time for that, Julie-ann?
Yeah, we sure do. But I'm
Okay.
looking forward to it.
And I do have this, I'd like to tell the audience, I would like for you to just mirror me in this energy movement, okay? Qigong is a moving meditation. It is moving our energy. Qigong is over 2,000 years old. It is very forgiving. So if you cannot lift your arms up over your head like I'm doing, and you can only go this far, that's all you have to do. Okay? You go to your point of comfort, and you go to your point of speed. So if you cannot keep up with me, that's okay. And you'll have this reference sheet to go by, okay? So if you're able to, stand up, but you can also do this sitting down. And this is 5 simple energy movements that I do every morning to get myself going. And I also do it during the day when I want a little extra energy, okay? So I'm going to take just a drink of water. It's always good to hydrate when you're doing exercise.
Yeah. While you're doing that, so this is what we have on Janet's gift link. So that's where it is for you, so that you'll be able to repeat it and maybe even build it into a habit.
Okay. So the first thing is going to be tap, okay? So if you are sore or maybe you bruise easily, you can just brush your arms, okay? But if you're able to, you want to tap to get those meridians going. So I went up my arm, I'm going to go down, I'm going to go up, down, one more up, and then I'm going to hit the back, my shoulder, and I'm going to go down the side, waking up with those meridians. I'm going to do one more and go down the side. And then we're going to do the next, our other arm. Down, up. Again, we're waking up. Back. And down the side. Now we're going to tap our lower abdomen. Now you can do that with some force or lightly, whatever you're comfortable with. And certainly if you just ate, you want to do that lightly. And then you want to tap your back, and you can bend a little bit. I tap on my lower back. And then if you can, tap on the kidney area and give it a good rub. That stimulates your adrenals, okay? Oh my goodness, my dog is joining me. Okay, then we're going to tap the legs. So you're going to go down the outside of your legs and tap the inside. Go down again, tap, and up. Okay, that was the tap. Now we're going to bounce. And again, do this as best you can. I have my palms to the floor, and I'm going to tap, hitting my heels lightly against the floor, okay? And you can do this sitting too. But this is waking up the meridians, stimulating our bones. Okay, that's the tap, that's the bounce, the squeeze. Now, this may look a little silly, but this is getting some nitrous oxide in us, okay? So I'm going to raise my arms up over my head. Again, you go as far as you can. Once you're going to breathe in. And then as you go down, you're squeezing everything. Your face, you're making a fist. You're squeezing your toes, you're squeezing your buttocks. Squeeze as much as you can, okay? So we'll do this too. So I'm going to breathe in. When you go, make a noise as you're breathing out, and I rotated my arms. So we'll do one more. Breathe in. Okay. Now, due to time, you would do that several times. That's the squeeze. And then shake. Now we're just telling our body we're shaking out anything that might be troubling to us, shaking it out. And we're going to end with a flow, getting our body back into a normal rhythm. And this is called, I'll go this way. You want to keep your back, tailbone down, head straight. And we're going up, breathing in, going down, breathing out. Breathe in, breathe out. One more. And now end with your palms facing down and just kind of stand there. See if you notice anything. I get what I call a body buzz, a little tingling. I feel that in my hands. I feel that in my body. And that's what it's, giving you an indication that you're waking up your meridians and the energy in your body. And talking about Qigong would be a whole class in itself. But I wanted to offer this to you as a way, a little routine that you can do a few minutes to give you some energy. And you do it, if you do it slow, check in on yourself before you do it, okay? So I didn't mention that. So before you start, check in on how you're feeling emotionally, physically, and then after you do the exercise, you check in again. Do I feel any different? And where? Okay. And I think it works for me, and I hope that it can benefit you too with giving you a little exercise. And my dog is taking over the room here. So anyway.
That's so helpful because, so often we hear, well, we should move more, but what do you do when you're going to move more? Having
Exactly.
something
Exactly.
like that that's put together in a helpful way is so much different than just thinking jumping jacks.
Yes. And the movement and the slow, this again was a warm-up kind of thing, but Qigong is slow energy movements. And when you think about it, it's moving our blood, it's moving our lymph, our muscles, we're stimulating the bones. And it's over 2,000 years old. It did well for over all these years for longevity and health. So thank you so much for letting me participate in this, and I hope that it was beneficial.
Oh, yeah, very much so. Thank you so much for making the time. And my goodness, I think I did not ask you a simple question when I asked you to help us simplify um, home health because there really are quite a few points. But I think hopefully I took fairly good notes. So for those of you who are getting my notes, it might be something that you can go back to, or of course, I want to encourage you to go back to the recording as well. Oh, and can we put in how to follow up with Janet? Send her an email. And there's also the information from how to do that exercise that we just did. That's included
Right.
as her free gift.
Yeah. So thank you very much. Thank you very much.
Yeah. Since we've just done this really cool movement thing, there is a summit participation encouragement thing that I'm sure will recognize of being able to check off the things that you've done. And if you don't have that already, we will send it again. And just go through and go back and do it on the recording if it didn't happen the first time, to just take this moment to jot down in that workbook, what is your takeaway, what is your application of and you know, maybe what's not working with you. I was just suggesting have an apple. Not everybody likes apples. Maybe you want to think about a peach. Um,
Exactly. Yes, right. Andrea mentioned too, what works for us, right? What food is going to make us feel good? What puts a smile on our face when we eat it?